Improved nanoparticle production uniformity enabled by a novel nanopore sensor technology by An Nguyen and Bianca Chavez. This research focuses on two main goals: optimizing the targeting nanoparticles for treatment of peripheral arterial disease and quantifying the heterogeneity of nanoparticles batch to batch in terms of coding and loading efficiencies. We propose using intracellular adhesion molecule 1, ICAM1 antibody, as a novel targeting molecule to help improve delivery of drugs to hypoxic muscle tissues, and employ novel nanosensor technology that can screen large numbers of nanoparticles one at a time. Our preliminary results demonstrate the successful fabrication of the nanosensor and some of our in vitro results to support the role of these nanoparticles in PAD treatment. In addition, we discussed the near future studies planned for this project. Peripheral arterial disease is a common occurrence in the elderly and in diabetic patients. It is in fact one of the leading causes of morbidity and mortality in the world. Current treatments such as bypass and stent interventions, gene therapy, and stem cell therapy show poor therapeutic efficacy, which could be ameliorated by the use of novel nanoparticle-based interventions. We are developing a new targeted drug delivery nanoparticle system to overcome the limitations of current PAD treatments and use a novel nanosensor to improve the uniformity of these preparations. For our experimental design, first we manufacture surface-modified nanoparticles to carry drugs. Next, we perform conventional absorbance and fluorescence tests. Then we employ nanopore sensing, which utilizes the whole size of individual nanoparticles to determine their shape, size, and surface charges, enabling us to assess the coding efficiency of each nanoparticle for quality control. The nanoparticles were prepared through emulsification and loaded with the desired drug, then conjugated with ICAM1. Once conjugated, they can be characterized by using the nanosensor. Finally, we use these nanoparticles in vitro and in vivo assays. For our experimental results, we can see in Figure 4 the depiction of a successful fabrication of the nanopore. Figure 5 shows the staining of PAD tissue with nanoparticles that have ICAM targeting moieties. The results demonstrate the successful targeting of the nanoparticles to hypoxic muscle tissues, indicating their potential use in the treatment of PAD. In Figure 6, you can see a comparison of BSA and ICAM nanoparticle coatings, with the highest uptake recorded at around the 30-minute mark, before the uptake decreases. The ICAM nanoparticles seem to have a higher uptake period, as shown in the graph, during the 30 to 60-minute window, before rapidly declining to a similar level as the BSA nanoparticles. These results are significant as they demonstrate the potential of using ICAM targeting moieties to enhance the uptake and efficacy of targeted drug delivery nanoparticles. Additionally, the data on coding efficiency will help us to further optimize our nanoparticles to improve their therapeutic efficacy. In conclusion, we have successfully drilled a 300 nanometer nanohole using a focused ion beam, which is an important step towards optimizing the fabrication of our MPs. This will help us to improve the uniformity and efficacy of our drug delivery system. Secondly, we have observed a high upregulation of ICAM1 expression in the ischemic tissues of PAD mouse models. This is significant because it suggests that our targeted drug delivery system, which consists of alpha ICAM1 PLGA nanoparticles, has the potential to effectively target and treat PAD. In addition to these in vivo results, our in vitro studies have shown that our drug delivery system can enhance targeting in activated endothelial cells. This is an important finding because it provides further evidence of the potential efficacy of our system. Finally, we are also studying the capability of our nanosensor to quantify the heterogeneity of nanoparticles and use this information to improve the uniformity of our nanoparticle preparations. This will help ensure that our drug delivery system is as effective and consistent as possible. In conclusion, these results are highly promising and suggest that our targeted drug delivery nanoparticle system has the potential to significantly improve the treatment of peripheral arterial disease. Thank you for your attention.